Electrolyte imbalances in congestive heart failure, CHF, treatment, an overview. Living with congestive heart failure, CHF, means actively managing your health to help your heart work its best. CHF is a chronic condition, meaning it's a long-lasting or lifelong illness. A key part of this management often involves medications called diuretics, or water pills, which help your body get rid of extra fluid that can build up and make you feel unwell. While these medications are vital for easing CHF symptoms like swelling and shortness of breath, they can sometimes affect the delicate balance of important minerals in your body called electrolytes. Understanding these electrolytes, what they are, why they matter, and how diuretics can influence them, is essential for your well-being. This article will help you recognize potential signs of imbalance, interpret what your doctor might tell you about your lab results, and empower you with practical steps to manage your health effectively. What are electrolytes? Electrolytes, including sodium, potassium, calcium, magnesium, chloride, phosphate, and bicarbonate, dissolve in bodily fluids and carry an electric charge. Think of them like tiny batteries in your body, powering essential functions. These charged particles help send messages between your brain and muscles, keep your body's fluids balanced, and control your blood pressure, among many other critical processes. Diuretics and electrolyte loss in CHF. Different types of diuretics used in CHF treatment can lead to varying patterns of electrolyte loss. Loop diuretics, e.g., furosemide, bumetanide, torsemide. These potent diuretics, acting in a specific part of your kidneys, can lead to significant losses of potassium, hypokalemia, low potassium levels, magnesium, hypomagnesemia, sodium, hyponatremia in some cases, chloride, hypochloremia, and potentially calcium, hypocalcemia. Hypokalemia is a major concern in CHF due to the increased risk of serious heart arrhythmias, which are abnormal heart rhythms that can be dangerous. Thiazide diuretics, e.g., hydrochlorothiazide, chlorthalidone, metolazone. Working in another part of the kidneys, thiazides can also cause hypokalemia and hypomagnesemia, though generally to a lesser extent than loop diuretics. They can also lead to hyponatremia and hypochloremia, but uniquely, they can sometimes cause hypercalcemia. Potassium-sparing diuretics, e.g., spironolactone, eplerenone, amiloride, triantarine. These diuretics help the body retain potassium while excreting sodium and water. As such, they can lead to hyperkalemia, particularly in patients with kidney issues or when combined with other potassium-raising medications. They generally help prevent the loss of potassium and might even slightly increase magnesium levels. SGLT2 inhibitors, e.g., empagliflozin, Jardiance, while primarily used for blood glucose control, SGLT2 inhibitors also have diuretic effects by increasing glucose and sodium excretion. They generally have a neutral or slightly positive effect on potassium and magnesium levels. Hyponatremia is a potential risk with SGLT2 inhibitors but is generally mild and self-limited in most patients. Symptoms of electrolyte imbalance. The symptoms of electrolyte imbalance can be varied and depend on which electrolyte is affected and the severity of the imbalance. Common symptoms include weakness, muscle weakness, a reduction in muscle strength and difficulty performing physical tasks. Fatigue, feeling unusually tired and lacking energy. Muscle cramps, spasms, or twitching, involuntary muscle contractions. Nausea and vomiting, feeling sick to the stomach and throwing up. Headaches, persistent or severe pain in the head. Irritability and confusion, feeling agitated, disoriented, or having difficulty thinking clearly. Changes in heart rate, arrhythmias or irregular heartbeat, feeling like the heart is beating too fast, too slow, or irregularly. Changes in blood pressure, either high or low blood pressure. Numbness or tingling, particularly in the limbs, fingers, and toes. Dizziness, feeling lightheaded or unsteady. Dehydration, feeling excessively thirsty and having dry mucous membranes. Severe symptoms. In severe cases, imbalances can lead to seizures, coma, severe muscle weakness or paralysis, significant changes in heart rhythm, and breathing difficulties. Long-term, even slow losses of electrolytes can contribute to systemic muscle loss, muscle atrophy, due to impaired muscle function and protein synthesis. Recognizing potential electrolyte imbalance, the importance of symptom awareness. While lab tests are the definitive way to diagnose electrolyte imbalances, being aware of your body's signals is crucial, especially when managing CHF with medications that can affect these vital minerals. Certain symptoms can be associated with electrolyte disturbances, but it's essential to remember that these symptoms are often nonspecific and can have other causes, including the progression of your heart failure or side effects of other medications. Symptoms that might suggest an electrolyte imbalance warrant a call to your doctor. These include muscle-related, increased muscle weakness, unexplained fatigue, muscle cramps, spasms, or twitching. Call your doctor if you experience a sudden increase in muscle cramps, especially if they are severe or don't go away. Cardiac-related, new or worsening heart palpitations, feeling like your heart is skipping beats or racing. Contact your healthcare provider if you notice your heart rate is consistently much faster or slower than usual, or if you feel frequent skipped beats. Neurological-related, increased dizziness, lightheadedness, confusion, irritability, or numbness and tingling in your extremities. Report any new or worsening dizziness or lightheadedness, particularly when standing up. Gastrointestinal-related, persistent nausea or vomiting. General well-being, feeling unusually unwell or experiencing a significant change in your energy levels. It is crucial to understand that experiencing one or more of these symptoms does not definitively tell you which electrolyte is out of balance. For example, muscle weakness can be a sign of low potassium, low magnesium, or even high calcium. Heart palpitations can be caused by low potassium, low magnesium, or high potassium. Self-treating with over-the-counter electrolyte supplements based solely on these general symptoms can be dangerous and might address the wrong issue or even cause harm by leading to an excess of a particular electrolyte. Therefore, instead of trying to self-diagnose and treat based on symptoms, your primary action should be to promptly communicate any new or worsening of these symptoms to your healthcare provider. They can then determine if blood tests are needed to check your electrolyte levels and guide appropriate and safe management. Other important electrolytes. While sodium, potassium, calcium, and magnesium are frequently monitored, chloride, phosphate, and bicarbonate are also crucial electrolytes. Chloride imbalances often mirror sodium imbalances, contributing to dehydration and potentially acid-base disturbances. Phosphate is vital for bone health and energy production, with imbalances occurring in certain medical conditions. Bicarbonate plays a key role in maintaining the body's pH balance. Tetany versus tremors versus seizures. It's important to distinguish between different types of involuntary muscle activity. Muscle cramps, sudden, involuntary, and often painful contractions of a muscle. Tetany, a more severe condition characterized by continuous or intermittent, prolonged muscle spasms throughout the body, often due to low calcium levels. Tremors, rhythmic, involuntary shaking movements. Seizures, sudden, uncontrolled electrical disturbances in the brain, which can manifest in various ways, including muscle contractions and loss of consciousness. Seizures are generally considered more severe than tetany and tremors, indicating significant neurological involvement. Severe electrolyte imbalances, particularly low sodium or calcium, can sometimes trigger seizures. Interpreting lab results versus symptoms. understanding individual balance. It's crucial to understand that while lab test results provide objective measurements of electrolyte levels based on statistical, normal ranges, these ranges may not reflect the optimal balance for every individual. Your doctor will consider your overall health, other medications, and your specific CHF condition when interpreting your lab results. What's normal for one person might need adjustment for you. Don't be alarmed if your levels are slightly outside the general, normal range if your doctor says it's appropriate for your situation. Trust their guidance. Therefore, healthcare professionals must consider both lab test results and a patient's symptoms together. Management in CHF treatment, what you can do. Given the potential for diuretic-induced electrolyte imbalances in CHF patients, careful management is crucial. This includes regular lab monitoring, judicious diuretic use, doctor-guided electrolyte supplementation, dietary management, and prompt reporting of any concerning symptoms. Here are concrete steps you can take. Medication adherence is key. Take your diuretics exactly as prescribed, at the same time each day. Do not skip doses or double up without talking to your doctor. Use pill boxes or set reminders to help you remember your medications. If you have trouble affording your medications, talk to your healthcare team about resources. Daily weight monitoring. This is a crucial indicator of fluid balance. Weigh yourself at the same time each day, preferably in the morning, after urinating, and before eating, using the same scale, and wearing similar clothing. Call your doctor if you gain more than 2 to 3 pounds, about 1 to 1.5 kilograms, in one day, or 5 pounds, about 2.3 kilograms, in a week. Your doctor may provide slightly different target ranges based on your individual condition. Dietary management. Your diet plays a significant role in managing fluid and electrolytes. Sodium restriction. Reiterate the importance of a low-sodium diet, as it directly impacts fluid retention and thus diuretic needs. Read food labels carefully for sodium content. Look for low sodium or no added salt options. Avoid processed foods, canned soups, frozen meals, and fast food, which are often very high in sodium. Use herbs, spices, lemon juice, and vinegar instead of salt for flavor. Avoid salt substitutes unless approved by your doctor, as many contain potassium, which can be dangerous with certain diuretics. Potassium in diet. If on loop or thiazide diuretics, your doctor may recommend increasing potassium-rich foods, e.g., bananas, oranges, potatoes, spinach, or a potassium supplement. Always check with your doctor before changing your diet significantly or taking supplements. If you are on potassium-sparing diuretics, you may need to limit high-potassium foods and avoid salt substitutes. Your doctor will advise you on this. Hydration. Discuss your daily fluid intake goals with your doctor. They will tell you how much fluid is right for you, which includes all liquids, and sometimes foods like soup or gelatin. Do not severely restrict fluids without your doctor's guidance, as this can also cause problems. Regular lab monitoring. Your doctor will schedule regular blood tests to check your electrolyte levels. It's important to keep these appointments. Proactive questions for your doctor. Empower yourself by asking your healthcare provider these questions. What type of diuretic am I taking, and what electrolytes should I be most aware of? What are the specific symptoms of electrolyte imbalance I should watch out for with my medications? When should I call you immediately, and when can I wait for a regular appointment? Are there any foods or over-the-counter supplements I should avoid? How often will my electrolyte levels be checked? Role of your healthcare team. Your healthcare team, including your doctor, nurse, and possibly a dietitian or pharmacist, are all here to help you manage your CHF and electrolyte balance. Don't hesitate to ask them questions or voice your concerns. Conclusion. Electrolyte imbalances are a significant consideration in the treatment of CHF with diuretics. Understanding the mechanisms of diuretic action, their impact on various electrolytes, and the nuanced interpretation of both lab results and individual symptoms is crucial for healthcare providers and patients alike. Regular monitoring, appropriate medication management, patient education, and open communication are vital to prevent and manage these imbalances, ultimately improving outcomes and quality of life for individuals living with CHF. Remember, managing CHF and its potential impact on electrolytes is an ongoing process. Regular follow-ups with your healthcare provider are essential for long-term well-being.